Here we go. Hey, everybody. Welcome to Convergence Healing. This is Peter Bedard, and I am so happy you guys are joining us again. Thank you for being part of my life, and thank you for sharing all of this information. When you guys actually click like and share these videos and the different people that we are bringing to you, or I'm bringing to you right now, it just helps us live our life purpose. You know, one of my life purposes is to bring healing into the world more. And I don't necessarily mean medical stuff, but I mean healing, true healing, healing that is when we feel loved and cared for and accepted. And when we're in that experience, the medical stuff kind of takes care of itself at times. Not always. Sometimes we do need support. But when we have people that are helping us and guiding us, holding our hand through life, and shepherding us through a process, we all feel more cared for. And one of the reasons why I wanted to bring our next guest on was because I stalked her. She was referred to me, and she's somebody in the Western medical paradigm who has a lot of heart. I loved what she had to say about her work and how she had to deal with her own, the loss of her own father, and how important it is for the work that she does in connecting directly with her patients. And I also looked at her reviews, and Dr. Cindy Nadelman is Celina, sorry, Cindy. Celina Nadelman is amazing. Her reviews, she only has a couple on Yelp, but I found some on, gosh, I think Celina, it was the US News or one of those resources. And then there were sources that evaluated doctors. I did some digging, and her patients adore her. They all had amazing things to say about Dr. Celina. So without further ado, I would love you guys to meet Dr. Celina Nadelman. Dr. Celina, thank you so much for being on our little show.
Thank you for having me.
Well, it's a good thing. And you look amazing. It's so fun to see a doctor. You know, I have this opinion or experience of doctors who just really don't take care of themselves. Most of the doctors I know are a little overweight. They don't dress very well. They don't look all that good. And then for somebody like you to show up and you're like the glamour doctor. I mean, come on, you got the hair. You look great. It's fun to see that. Did you ever get feedback about that being in the medical field with at least the people I know in the medical field certainly not being very glamorous?
Not really. No one.
Well, maybe they're all afraid to say something because you look amazing. And it's fun to see. It's really fun to see that, you know, and you know, I love, most of my clients are women, and most of the people that tune into what I do are women. And it's so fun to see a woman in her power and in her beauty, and as she understands it, and doing, you know, in a power position. A doctor is a power position. It's an intelligent, amazing position. And I just want to applaud you just for that. I think that the more women like that are the example to stand up and just live in your power and your beauty, you know, where you're balancing the masculine and the feminine. I just love that. The masculine of the power of your career and the authority that you have, and the feminine of who you are is just beautifully embodied. So I hope you don't mind my saying that, but it just spontaneously came out. So tell us a little bit about what you do. You're a fine needle aspiration pathologist.
Yes.
A lot of people aren't going to know what that is. Give us a little nutshell about what that means.
So I not only interpret biopsies or fine needle biopsies, very small biopsies, but I also perform them. Most people don't actually meet their pathologist. They think of pathologists as, you know, on TV, like forensic pathologists, like NCIS, like Ducky, or someone who's sitting there doing autopsies all the time. Although I had to do that for my training, it's not what I do right now. I went, you know, extra schooling for board certification of cytopathology, which is really the study of cells, kind of cells in space. And, you know, there's, you know, cytopathology, like, you know, like cervical pap smears. And then there's aspiration pathology or cytopathology, which is what I do, which is called fine needle aspiration. And, you know, other people, other doctors can perform FNAs or fine needle aspirations, like endocrinologists or ENTs or surgeons, but none of them actually know how to interpret them. So that's what makes me different from everybody else who actually performs these fine needle biopsies. I see the patient, I do the biopsy, and then I can actually immediately look under my microscope while the patient's in the same room to see if I have what type of material, if I have enough material. Because oftentimes what happens is you go to see the radiologist or the ENT, they stick a needle in you, they send it off to pathology, someone like me in the laboratory, and they get a non-diagnostic diagnosis. So then you have to come back and have another biopsy. And so there's like this repeat biopsy. It makes patients frustrated. It makes doctors frustrated. This is kind of like a one-stop shop. And not only it's, my philosophy is really, taking a more holistic approach to cancer diagnosis, because basically that's what I'm doing. I mean, aside from cancer, I'm also looking at infection or inflammation, why someone might have a lump or a bump in their body. But most often than not, people are really looking out for cancer. So I want to be able to get all the clues I can and treat the whole situation holistically, the person, the biopsy, as well as the diagnosis.
Right. And people come to you mainly because they've been diagnosed or had a possible diagnosis that, hey, we may want to look at that. There's something going on that we're seeing, and let's go ahead and have a biopsy on that. And I
Right.
know I had something like that. I had skin growth, and it was kind of strange because it was on my chest, but it moved, and I never paid attention to it for years. It literally moved. And I was told that it was no big deal. Cancer doesn't move. It moved a good 4 inches across my chest. And that was not supposed to be a cancerous thing, but it was this little growth and it just kind of slid over towards my shoulder. And eventually I said, all right, I should probably got a little bit bigger. And I said, I probably should have it looked at. Well, the doctor came in and just gouged this area out. Like it's still this scar that's the size of like a nickel. It's this
Right.
big, it's a pretty big size scar now, this indent that they did on my body, like almost like they took an ice cream scoop and just scooped this thing out. I had no idea what fine needle aspiration was, and it wasn't even offered to me. It seems like what you do. Mhm.
Yeah, I mean, things like skin growths, those are kind of flat lesions. I mean, if you're
Mhm.
considering the layers of the body, and so what you had done is appropriate. Fine needle aspiration would rarely be done for like a skin tumor. Like if they thought that it was a skin tumor, but if they thought that it was something underneath the skin, then you would possibly come to someone like me
So if
for
you
fine.
had a bump, is that like for breast cancer? If there was a lump or if somebody had something, it's about going underneath the skin, which is what the fine needle is for, to get
Yeah.
down deep.
Well,
Am I understanding that correctly?
it's not so deep. Like I don't do lung biopsies, I don't do kidney biopsies, I don't do liver or pancreas biopsies, but I do things like thyroid, breast, head and neck, lymph nodes, salivary gland tumors. I mean, I've done lumps and bumps all over where I can reach it and I can see it with an ultrasound. I use ultrasound a lot of times where you can't actually feel it with your hand, but it was maybe picked up on other imaging or something else. Maybe you had some other symptom and then you got imaged and you said, oh, there is a lump underneath. And so I use ultrasound as a tool to help me see better underneath.
So
And that,
the ultrasound image actually guides you in the placement of the needle,
yes,
right?
yes.
So
Even
this
if I,
is far,
yeah,
go
even if
ahead.
I can feel it, I use ultrasound a lot of time, unless it's so shallow. Like I do biopsies sometimes of fatty tumors called lipomas, and sometimes lipomas are too close to the surface of the skin, and so the ultrasound interferes with the actual biopsy. But most of the time, I use ultrasound as guidance.
Right. And as we were talking before went into the interview, you're a California girl and I'm a California boy, right? Born and raised. I think that's awesome. And you actually went to school all the way through to get your doctorate in California. You didn't leave the state.
Well, I left the state. I went to Massachusetts for
Oh, you
undergrad.
went to Harvard.
No, I went to Clark University.
Clark. Okay. I
Yeah.
missed that. So you went to Clark, but you also went to UCLA and USC.
Yes.
And you got your, so I just think that's great. And I think that California has such a great, it's great to live in a state that has such good education and medical care. I think
Right.
that's just very special as far as California goes. People say to me, "Why do you want to live in California? It's too expensive." And I say, "Well, why wouldn't
Wouldn't
you?"
wanna why who wouldn't wanna live here?
Exactly. That's basically how I feel too. And how great that you got to be here. You also said that your kids were following in your footsteps.
Well, they go to school here, but I don't know if any of them are, they're not yet old enough to choose their careers, just
Mhm.
quite yet. But my
Good.
oldest son went to UCLA actually. So he stayed in state for college. So yes.
That's great. Now, I know that there's a reason why I became a therapist, right? There's a reason that gets most people into the profession. And for a lot of doctors, I've heard a reason that somebody when they were young, let's say somebody was diagnosed with something, their mother got cancer, their uncle had a stroke, and they just said, you know what? I want to figure out that. I don't want anybody as a kid. They said, I don't want to ever see that again. I'm going to go and be a doctor and I'm going to do my best to cure that experience, the child's mind, right? I'm going to go in there, and that's the driving force, right? For a lot of people in the care world, right? Doctors, physicians, all different people, psychologists, therapists, all that type of stuff. Do you have a story that really drove you or brought you into medical practice?
Well, actually, strangely enough, I wanted to be a psychologist, and which
Okay.
is one of the reasons why I wanted to, where I ended up at Clark University because that was the like it was huge psychology school. It's the school that Freud and Jung came to when they came to the United States, and so I thought I would be a therapist. And then I got interested in neuroscience and studied neuroscience, and I just felt like when I did work in neuroscience, actual clinical work, it wasn't really what I had thought it would be, and so I that's when I figured that I really wanted to go into medical school because that was more hands-on than what I was doing in neuroscience.
Mhm. Yeah, I absolutely love neuroscience. It's the brain body connection is just fascinating to me. So I was right there with you. And then you made the transition into being were you in general practice at first, or what made you
So,
come into doing the FNA work?
so I first started out in adult medicine or internal medicine, and some parts of it I really liked. I liked some, the interaction with my personal patients at clinic. I did my internship at the VA. I really liked working with the vets. I really enjoyed that. And actually, after I finished my residency in pathology, I went back and worked there. Um, and I felt like it wasn't a good fit for me. It's very algorithmic and I'm very visual. I was also an art major. I was a psych and art major, so I kind of always liked pathology, but when I was in medical school there was a big push towards primary care, so it really wasn't in the forefront of my mind. But my mother's friend, he was a pathologist and he was a very uh, not famous pathologist, but he was very involved. He was lab director of St. Joseph's in the Valley, and he was like the president of the American, Association of Pathologists. And he said, "Why don't you try pathology?" So I tried it for a year, and I fell in love. It was very much kind of what I liked. I and then I went on and when I was at UCLA as a resident, there was a pathologist who came and spoke to us and said, I run a fine needle aspiration clinic, which was almost preposterous because most pathologists don't see patients. They don't have a face to face with patients. And I thought, oh, this is perfect. I like doing procedures. I like seeing patients. I like looking at, it kind of combines everything. And I said, that's what I want to be. And so at the time, I mean, I think there was maybe, I don't know, 3 or 4 FNA specialists, like standalone FNA specialists in the United States when I was thinking about it. Now there's about a dozen or so in the entire United States that have a standalone clinic. I mean, in
Wow.
large hospital settings or academic settings like UCSF, they have a big FNA clinic, or USC, they have a big FNA clinic, but it's not a standalone private practice. And when I used to go to, mixers, like where I would meet other physicians, they would say, "Wait, what do you do? You actually see patients as a pathologist?" They were astounded. They couldn't believe me. Or when I went to see when I went to conferences, pathology conferences, they said, "What? You have an FNA practice? Are you crazy?" Or they would say, "Wow, you're brave." you know?
Well, you're obviously not afraid of people and you actually love people. And that heart is what one of the things that really attracted to me to you. You have this very big heart. And it's interesting that you're talking about how these doctors are like, what? You actually see people? That big heart is amazing. And I think it's something that's missing from a lot of allopathic medicine. People are looked at as a lab result, or they're looked at as a number that's being processed through their system or their oncology lab, right? And what I was impressed with you is that you're really there. And like I said in the beginning, people felt heard with you. When I looked at all those reviews and people talked about the work you did, that's an element that I think has been missing. And so I'm emphasizing that because, one, I want to bring kudos to you because I just think that's awesome that that is there. And I'm wondering if there's a way to bring that more into medicine, if there's a way to bring more heart, more care, more of that. I don't know if there is. I don't know if it's something that you can teach. It's something that you seem to just do, and it's something that you thrive off of.
I think for the main part, most doctors, I mean, most people who go into medical school, they start off that way.
Mm.
Um, there are very few people who don't look at medicine with heart. I think as time goes on, or maybe restrictions on what physicians can do, or even their, reimbursement, um, kind of starts to stymie, their heart, I guess, um, and I just think, doctors are human, and I think that sometimes some doctors are maybe not as emotionally engaged, partly because they need to be detached if they're dealing with very stressful situations, and part of the time because they're rushed and they don't have time, and part of the time is because they feel like they're being taken advantage of the system by the system.
Well, I can tell you as a therapist, it's important to learn how do I stay connected with my clients without taking on a responsibility for them. And I think that people just detach instead of actually doing the work, and they just sort of completely, sort of make their patients as just a number because it's easier to deal with all the pain that they're actually witnessing. When
I,
it's hard to be present with all that pain and to then allow yourself to let that go and say, that's not mine. That takes some work.
it does, I think so, and it takes practice, I think, and also um, I think it has to do with also being intuitive or understanding. Like for instance, I wanted to make my practice different from the usual places that people might get a biopsy. Let's say a radiology clinic where you may not really have that much interaction with the person who's actually performing the biopsy. And I really want to concentrate on the experience of the patient. And so I started noticing, like when I was going into different doctors' offices, like what made me feel comfortable in their office and what made me not feel comfortable, from the way the seats were in the waiting room and the lighting, to how the receptionist was greeting me, to how the room was, and how the doctor also treats, directly the patient. Because when patients come to see me, it's already stressful. I always joke with them. I always say, my patients say to me, "We love you, Dr. Nadelman, but I never want to see you again," because, basically they're coming in because they want to know whether they have cancer or not. They don't want to go through that stress again, which I totally understand. My other friends who are pediatricians or OBGYNs, they get tons of presents from their patients, but my patients are like, "I don't want to see you." So, um, with that in mind, whoever I hire as my front office person, I always talk to them about how to treat the patient. I say, different people deal with stress differently. And when they come here, everybody is stressed. There's really not one person that can just be like, oh, I don't care about it. And some people are calm and some people are not. Some people yell at you. They maybe call you names. I've had patients who are lost and call and start cussing out my front office person because I understand they're stressed out about the appointment. And I tell my assistant to just let it float off your back and realize that they're in a very stressful situation and just help them through that stressful period. So it's really important on how we're treated even up front, even before they even see me, so that their experience is that much better. There are people who deal with it by crying. There are people who I've had people throw up. I've had people pass out. And I've had all situations. People are embarrassed. They feel like, oh, they're being chicken, or I've had I've had people faint. So it I've seen the whole gamut.
Right.
And so I want to be sensitive to that. And I just, I really want to stress that they're here to get the best care possible, and that's what's really most important. And
Absolutely.
if it makes it easier on them, then that's what we're here for, to make it easier.
I love your point of view, and thank you for bringing compassion as one of the elements in the experience of going to see you. That's such a huge thing, and to have that holistic awareness of how people feel when they walk in the door. I once worked with a team of doctors that were talking about cancer, and I sat down with them to have a conversation with them, and they all talked about how they would ask their patients what was going on in their life 6 months to 18 months prior to their diagnosis. And they found a commonality that there was a trauma, there was a loss, there was some sort of experience of financial catastrophe or something that had happened in people's lives prior to the diagnosis, which suggests that there's a mental emotional causation for the physical showing up of cancer. So to come from that approach when somebody's already in the experience or potentially in the experience, and you're going to guide them through to find out, you know, there's already something that's happened that caused that experience to show up physically in the body. That's it, at least how I look at things, that stuff doesn't happen just randomly. We are exposed to something, or something happens in our lives. Our thoughts affect our DNA, and then the result of that fear, judgment, depression, sadness, trauma turns into the undigested emotions, turn into something physical that then walks in your door. And to have the kindness and compassion for that person walking in the door, not even knowing, but just assuming that they're having a bad day or they're having a difficult time, and bringing them love is just a lovely thing. So thank you for taking that approach. That kindness, I think, goes a long way. You had, before we started recording our session today, you had mentioned COVID and talking about the COVID pandemic, and you wanted to share a few things about that with people. You had a personal loss during COVID, and once again, I'm so sorry. These it's a tough thing, and I just want to acknowledge that and acknowledge your strength for being able to just keep going and continue to be compassionate. So, what did you want to share about COVID specifically?
Uh, well, specifically COVID, I think that as I was telling you previously, I started thinking about why certain people were getting hit harder or having bad outcomes of COVID more than other people. I mean, seemed pretty random. We take for granted that the elderly get hit, but it wasn't like flu where you get two populations where you get the young and the old, but it was just the old, and then you would get randomly people who were don't seem to be unwell get hit really hard with COVID. And so I started seeing which population of those people like what was it about them that made them more vulnerable to the bad outcomes of COVID-19. And these were people who had cardiovascular health risks like high blood pressure, obesity, diabetes. And seeing that, and then looking at autopsy information from my pathology journals, they started seeing that there were things that were happening in our vessels um, throughout all the autopsy patients of COVID-19. So I started looking into perhaps we can bolster our cardiovascular system. I mean, aside from eating well and dieting, exercise, keeping your high blood pressure under control, keeping your diabetes or your glycemic, index under control. Um, I think that we can perhaps do something that helps our what's called endothelium, the lining of the vessels, by kind of helping them and maybe giving them a little bit more uh, um, strength. Uh, we can maybe prevent, even if you get COVID, prevent the bad, really bad outcomes like stroke or really bad pneumonia from actually happening to you. And so these are supplements that have been around and been discussed for years for cardiovascular health. Like they're touted for cardiovascular health. And so I was thinking, this is what we can do. We can empower ourselves by just taking, simple supplements, vitamin C, vitamin D, magnesium, resveratrol, which is found in, the whole like French paradox, red wine and grapes, flavonoids, which is found in, tea and cocoa. We want to increase the health of our vasculature so that it becomes more resilient to any kind of, invaders or bad, I guess bad stuff that can, kind of get it off kilter. And so that's basically where I was going with this. And I've gone on to like uh, write a paper about the dysfunction of our vessels, and perhaps we can learn about it and, you know, protect ourselves,
Yeah,
as we
that's a good idea, and it's a good resource for people. So thank you for bringing up not only the topic, but the specific solutions that people could use that could potentially help. Like I love herbs and supplements and vitamins, all that type of stuff. I have a little healing tea company, and like I love what Mother Nature can share with us, and I particularly like hawthorn and nettle and ashwagandha. Oh my gosh, ashwagandha is amazing for the heart and for blood flow, or just simple things like cinnamon. Cinnamon in its own, turmeric, right? Cloves, ginger, all that type of stuff. Good for the gut, good for the blood, good for the heart, all those types of things. So when we can consciously think of ways, hey, what are these simple ways, like all those vitamin C, all the supplements that you had, and a bunch of what I said, right? When you consciously say, you know what, I'm going to bring this into my life because I know my environment has the potential for me to be affected by this hostiles, let's say. So I'm going to bring them into my body as a way to act as a first defense. And I really appreciate you sharing that type of information. I think people are looking for it. And I love that somebody in your position is saying, hey, why not? Is I know in the past my doctors used to poo-poo a lot of vitamins and supplements things, and now I'm hearing all the time of, oh my gosh, COVID, vitamin C, vitamin B, magnesium, vitamin D, like take these things. They were finding out that they're working and they're helping. So it's fun to see more integrative type of things happening instead of where you're over there and we're over there and we're not coming together. It's really, I think, very positive. One of the things that's coming out of this pain that we're all globally experiencing is a more willingness to work with each other and to try different things and to be open to what is out there and what do I know and what do you know, and let's just see how these come together. So thank you so much for sharing all of that. Before we go, do you have I forgot to ask earlier, do you have a way that people could connect with you? I know we have drnadelman.com, right? as
Yes.
your website. Are there other ways that you would like people to connect with you on Yelp or LinkedIn or any of those type of platforms?
Um, I'm available. I have Instagram, LinkedIn, a Facebook page, all under Celina Nadelman MD or Dr. Celina Nadelman MD. And then on my website, there's also an email, or you can also there are articles on my website, or a bio, things like that.
Right.
Dr.
Your name
Celina.
is so easy to say and it just kind of flows,
Yeah.
Celina Nadelman. But just so people are getting it easily, spell it out for us so that they know, like drnadelman.com is spelled.
Nadelman.com. So it's Dr. DrNadelman.com.
Beautiful. Thank you so much for doing that. Thank you for sharing your presence. Thank you for sharing your strength and your expertise. I really appreciate that, and I know the people that are tuning into my little podcast are as well. So we'll get this posted on our different platforms. For all of those that do not know, you can actually connect with me through my brand name, which is Convergence Healing. You can find Convergence Healing on LinkedIn, on Facebook, on Instagram. You can join our group called Cultivating Joy Convergence Healing on Facebook if you would like more joy or to bring more joy in your life. And you can find convergencehealing.com for more information about my practice. Celina, thank you so much for your energy and for your heart. I just love that you, in this time where a lot of people are not being examples of the greatest behavior because they're overwhelmed or overworked, and they're coming into the world or into their patients or their clients with not the best attitude. I so appreciate that you're just out there with that open heart and sharing all that love. Thank you for that. I want to make sure that's acknowledged because that's important. And to everybody else, stay tuned, stay healthy, stay strong, and namaste. Ciao, guys.